PCRA is a dynamic process used by healthcare workers to evaluate potential risks of infection transmission at the point of care. It involves assessing the patient, the task, and the environment before performing any procedure or interaction. Using eAuditor ensures a structured, real-time evaluation of infection risks, streamlines assessments, improves documentation accuracy, and enhances compliance with safety protocols. Evaluate symptoms, medical history, known infections, immunocompromised status, and isolation requirements to determine potential infection hazards. Assess level of contact, exposure to bodily fluids, aerosol generating procedures, and use of invasive devices to determine infection control requirements. Examine ventilation, surface contamination, hand hygiene stations, and medical equipment handling to identify environmental risk factors. A thorough patient risk assessment is essential to determine potential infection hazards. Healthcare workers must identify symptoms such as fever, cough, shortness of breath, or rash, known infections like tuberculosis, influenza, MRSA, or COVID-19, immunocompromised status from conditions like chemotherapy, HIV, or organ transplants, isolation requirements including contact, droplet, or airborne precautions. The type of procedure performed significantly determines infection control requirements. Using eAuditor, healthcare staff can assess level of contact, determine whether the procedure involves direct contact with the patient's skin, mucous membranes, or open wounds, bodily fluid exposure, evaluate risks related to blood, saliva, respiratory secretions, urine, or other potentially infectious fluids. A proper PCRA includes evaluating the patient's surroundings as environmental factors contribute to infection transmission. Evaluate surroundings for infection risk, ventilation, surfaces, hygiene access, especially in airborne precaution areas, surface contamination on high-touch areas like bed rails and door handles, availability and accessibility of hand hygiene stations, proper handling of medical equipment and soiled linens. Select appropriate PPE, gloves for direct patient contact, surgical masks or N95 respirators, eye protection for splash-prone procedures, gowns for contact with infectious patients, ensure hand hygiene, verify hand washing before and after patient interactions, ensure soap and sanitizers are stocked, monitor hand hygiene training compliance, document compliance, record proper donning and doffing of PPE, track adherence to protocols, document any breaches in procedure. Patient isolation. Confirm high-risk patients are placed in designated isolation areas with appropriate signage and barriers. Disinfection protocols. Ensure cleaning protocols are followed for medical instruments. Patient rooms in communal areas. Waste management. Verify that contaminated materials, use PPE, sharps, medical waste, are disposed of correctly in designated containers. Transmission precautions. Confirm adherence to protocols such as droplet precautions or contact precautions based on assessment findings. Benefits of digital PCRA: real-time data collection on mobile devices, automated compliance reports for infection control teams, trend analysis to identify recurring infection risks, regulatory compliance with CDC, WHO, and facility standards. Auditor transforms PCRA into a proactive approach to infection control, improving prevention, compliance, and patient safety through standardized assessments and real-time risk mitigation.